amazing number of Filipinos work in our NHS and unsung heroes.
Extremely annoying shift later.
Oh, sorry, excuse me, sir. Dito ba yung interview sa mga nurses? Oo, pero dito. Pero ongoing pa ata yung interview nila eh. Tignan mo na lang, pakisilip nila. Okay, salamat ha, thank you. Walang problema.
In the Philippines, we rarely speak to our patients, we rarely speak to our colleagues, and more so with doctors. Like they are so high up there that we do not communicate to them. But in Canada, you really have to speak up. You really have to be very assertive on behalf of your patients. You should be confident enough to speak to a doctor, to your colleague, if your patient's safety is at stake. So another difference that I'm going to tell you is the skills in assessment. I know we studied this, assessment skills while we were students, but my question to you, IENs, do you get to practice that? I doubt. Why? Because in the Philippines, we have interns, we have residents, we have doctors, we have students, and so you just look at the chart and they will document their complete assessment of the patient. So we do not complete it at all without practicing your skills in assessment. How comfortable are you assessing your patients and finding out what's wrong with your patient? That's a huge difference between in the Philippines and in Canada. Again, the machines are not the same here in Canada compared in the Philippines. We have less machines there. I remember when I was a student, we were using a ruler to measure the CVP. And then when I started working in Middle East, so there's an actual CVP. So imagine those. And I even worked in UAE wherein everything is disposable, everything is in a kit. In the Philippines, we have to gather everything. I need this one, I need this one. No, you don't even have to worry about that because in Canada, we have everything prepared for you. But you have to be familiar and confident in what you do. So, for example, another big difference, you are about to start an IV to your patient, okay? In the Philippines, you don't even explain at all. You just tell them, okay, I need to start IV, that's it. Here in Canada, you cannot do that. You will have to ask for consent, you will have to assess, as in assess. And if you believe, okay, even there is a doctor's order for that IV insertion, you believe that there is no benefit to your patient, you get to question the doctor.
Sana all ligtas.
Doctor, I don't think there is a need for IV for this patient at this moment. And this is invasive. I'm giving pain to a patient. Why do I have to do that? So you have to be that kind of confident in behalf of your patient. So that's a huge difference again. Do you think you can do